Emily Van Klompenburg is a pharmacist with Avera Health in Brookings, and she shares the importance of using an inhaler correctly. The inhaler is responsible for getting the medicine into our lungs, and there is quite a variety of inhalers. That's why she recommends a pharmacist teach patients how to properly use it.
When picking up an inhaler from the pharmacy, they are right there and they can go through the inhaler technique with it. And a lot of times my personal favorite is actually helping the patient take their first dose of their inhaler when at the pharmacy, so you can assess the technique right there and then.
Van Klompenburg says she sees many mistakes when patients start using inhalers. The first one is sitting hunched over when administering the medicine.
A lot of times they're very embarrassed about it, so instead of sitting upright with the lungs big and open, a lot of times they're hunched over and trying to breathe it in. And when you have compacted lungs, the medication doesn't get into our lungs as well when using inhaler.
Instead, make sure your back is straight, your chin is lifted, and exhale before taking a puff. It's also important after the puff to hold the medicine in your lungs for a couple of seconds before exhaling to make sure it reaches.
Again, sitting with the straight up with the lungs wide open, chin tilted up. We're going to breathe out. And that's that dose for that one.
The next big mistake Van Klompenburg sees is patients not using the long-term medication frequently.
I like to tell my patients with those maintenance medications, you're not taking it to improve your breathing right now or even tomorrow. It actually improves your breathing in 3 or 4 days from now, and that's why we need to stay steady with it.
The last big mistake Van Klompenburg sees is mistaking one type of inhaler with another. An example she uses is not every inhaler needs to be shaken before using, like a dry powder inhaler.
There are certain inhalers that we cannot shake, otherwise you dump the medication out of the inhaler, so then you're not actually taking any medication into the lungs.
For a dry powder inhaler, do not shake it, sit up straight, and lift your chin up for easy access to the lungs. Hold the inhaler like a hamburger, open the dose, and then bite around the opening.
A dry powder inhaler doesn't have a propellant in it, so it is up to me as the patient with my inspiration to bring the medication into my lungs. So it is a quick breath in with this one. So I'm going to breathe out around it because I don't want to breathe into my inhaler, and then I'll quickly breathe out in the inhaler in. So
And while inhalers can be expensive because of new patents and types, Van Klompenburg says inhalers help reduce the risk of hospitalizations and lung diseases.
So if we're able to make sure patients can use those maintenance inhalers regularly, then we can prevent these other sequelae and worsening of quality of life, and hopefully keep their breathing as best as possible for as long as possible.